Good afternoon, everyone. Susy Stark from Washington University here. Today we're going to talk about falls and aging with long-term physical disabilities. Many thanks to our Missouri Aging and Disability Research Network for suggesting this topic and for your interest in better understanding this issue. I wanted to start out today by talking a little bit about falls and aging, mostly because most of the research that we have available has been done on adults age 65 and older. And it's just now becoming apparent in the literature, and there's some emerging evidence that people with disabilities also experience an increased risk for falls and age as they age, even though they might be much younger. So let's take a look. First, what I would like to do is thank the agencies that are funding our research. First, the National Institute on Disability and Independent Living and Rehabilitation Research through a DRIP mechanism, and also Washington University Institute of Clinical and Translational Science from the National Institute of Health. So thanks for that, those resources that are helping us develop our community-based research network and helping us work together. So let me first talk about falls and aging. We know that older adults fall at the rate of about one every second of every day. It doesn't matter what the risk factors are, that's the averages. We know that as the number of risk factors that people have increased, like things like a mobility impairment, taking 4 or more medications, that risk increases. We also know that 1 in 4 older adults report a fall every year. Falls are the leading cause of injury, of morbidity, such as hip fracture, brain injury, one of the leading causes of premature institutionalization. Falls are also one of the leading, most expensive things that we have with regard to preventable issues that older adults have in the U.S. It's estimated that falls are costly at about $50 billion annually, including federal programs as well as private out-of-pocket costs that we might endure or experience. Falls are deadly. If we look at the death rates in the U.S., they increased 30% between 2007 and 2016. Falls, if we continue on this rise, we anticipate that we'll have 7 fall death rates every hour by 2030. So it's a pretty striking and substantial cause of mortality. But we know from our new research and from some work that's done before us that falls don't just impact older adults. People with disabilities, particularly people aging with disabilities, were facing new functional changes as a result of aging and chronic conditions they're experiencing as part of their disability are also at risk. And we picked this up in our recent study when we started to hear stories about people telling us how they've changed their lifestyle, changed their patterns, and have become pretty worried about falls. So we decided to ask them a little bit about it in our recent cohort study that we've undergone. And in year 1 of our data, we surveyed 470 people who are aged 45 to 65 living with physical disabilities. And these are people mostly across the state of Missouri, so rural and urban, but also some national responses as well. And when we asked them in the past 12 months, have you fallen? 65% reported that they've had at least 1 fall in the past month. So it's a much higher rate if you think back to the 25% rate that I presented for older adults. People aging with long-term physical disabilities who haven't reached 65 have a higher fall rate than those than older adults. Oops, sorry. And we also know that when they do have a fall, they have a very high rate of injury. So of those who reported falling in that sample, nearly 60% reported an injury that often required going to an emergency department. And in fact, it was 40% of the people who reported an injury that did indeed end up going to an emergency department for treatment. So this is a very high rate of falls in a group of individuals that don't always have a connection to the healthcare system who are becoming injured as a result. We also know that when we asked, how worried are you about having a fall? 75% of our respondents told us they were worried about falling. And in many cases, it changed their community participation, their work life, or their home life because of this increased worry related to falling. Unfortunately, the literature is not there. So we know there are over hundreds of randomized controlled trials of interventions that work for older adults, but just a very small handful of literature that's related to people aging with disabilities. Some of that work has been done in the area of multiple sclerosis, a little bit in Parkinson's, but very little overall for the general population of people aging in place. So what I thought we could do today is talk a little bit about what we know about fall prevention from the perspective of aging, and we can extrapolate some of that information to what we think would be useful for aging with long-term physical disabilities. So we know that in the older population, 6 in 10 falls happen in the home. It's where we spend most of our time. And it's also where we move around without thinking about our safety. So we're going to talk a lot about home modification today and what we can do. So this is a graphic that shows how I like to think about falls. Falls are kind of they're a compilation of 3 things. They're usually our abilities, which might be limited because in the case of this older adult that's standing precariously on some stools that she stacked up to get her turkey roaster from above her refrigerator, her abilities probably are no longer what they were when she was 35 and first stored her turkey roaster up there. She probably has some limited strength and maybe limited ability to reach, and that's changed over time. So falls are related to our abilities. They're also related to context. So the turkey roaster is up very high, so the environment isn't really set up for her to easily reach the turkey roaster. And also then her behavior, her choice to pull those 2 benches over to crawl up to get something out of her refrigerator really put her at high risk for a serious and significant fall. If we click one more time, we can see that some of these things happen with people aging with long-term physical disabilities as well. So when they first learned to do a sliding board transfer, they probably had a little more muscle strength, a little less maybe weight that they were carrying around when they were newly injured. And those normal aging-related changes that happen over time really, I think, even more than the lady we see on the top, begin to impact how safely we can do everyday activities. So I wanted to talk a little bit about fear of falling. I mentioned that earlier. We don't know much about fear of falling with people who have disabilities other than that qualitative data that I was sharing with you earlier. But we know in the older adult population, people who fall, even if they're not injured, develop a fear of falling. This fear of falling is sometimes more debilitating than the disabilities or functional limitations older adults are living with. Fear may cause them to further reduce their activities and really give them a greater risk of having future falls because they're limiting their physical abilities, their physical activity, which reduces their overall fitness. So one of the concerns I had when I read that qualitative data is what can we do to impact fear of falling for people aging with long-term physical disabilities? And I thought the first step we could take today is to really talk about fall risks that we know of and what we can do to reduce those fall risks. So you might have trouble walking or moving around if you're walking. Problems with unsafe footwear may also be a fall risk. So we always encourage older adults to make sure that they connect with a physical therapist or with their physician if they're having difficulty moving around. It's changed over time. Or if they are walking and have maybe a neuropathy caused by something like diabetes that's changed their sensation, it might be a good idea to address that fall risk. People who take 4 or more medications are at risk for a fall. So it's a good idea to reduce the number of medications that you take if you can, if it's safe, with your doctor's help, or to make sure you're taking medications that don't place you at an increased risk for falling. Maybe some medications might cause dizziness or some other thing. So if you have dizziness when standing up or sitting down, it's a good idea to talk to your physician to see if you can address that.
Maybe it could be a change in your medication, or it could be a change in how you get up maybe more slowly. If you have difficulty with your vision, we all have aging-related vision changes as life goes on. So changing how you, making sure that you get into your optometrist or your ophthalmologist annually to check your vision to see if there's anything you can do. And also then things that we're focused on in our lab is making sure there's no trip hazards in your home. So some of these are fall risks, and let's talk through a couple of these to see if there's anything that folks can do to reduce their fall risk. So I thought I'd take a second to show you a graphic that shows how important it is to address all the fall risks. So this is a graphic that, this is again looking at older adult data, not necessarily people with disabilities, but it shows us that with the number of fall risks, they increase from 0, in this case, to 4 or more, you have a change in your fall risk. So if you're 65 and older and you have no fall risks, then you have a 1 in 10 chance of falling next year. Contrast that with if you have 4 or more of those risks that I just mentioned, like taking 4 or more medications, you have an 80% chance of falling in the next year. So remember, this is older adults. We know from extrapolating from some of the literature that people aging with physical disabilities might double their risk of falls. And that's actually what we're beginning to see in our own data. So you have a greatly enhanced risk. So it stands to reason that the number of fall risks that you can reduce, you will hopefully eliminate some of that risk in your life. And that's what we're interested in sharing with you today. So the first thing I wanted to mention was if you're, no matter who you are, making sure that you have improved strength and balance, the best possible balance that you can have by visiting a physical therapist, or in some cases an occupational therapist, and getting some type of exercise built into your daily routine. At Paraquad, where we have our lab, there's a health and wellness center that has a specially designed fitness center that actually will support people with disabilities no matter what phase of life they're at, to build exercise into their life, because we know it's such an important part of maintaining your independence. We actually know that improving strength and balance for the older adult population is one of the most powerful tools we have in our fall prevention arsenal. This is one of the things that can make the biggest impact on fall reduction. The next thing that I want you to think about is actually reviewing medications. So we encourage people to talk to their physician or their pharmacist on an annual basis, or more frequently if your medications change, to make sure you're taking your medications correctly. It's a good idea that your primary care physician knows all the medications you're taking. It's a good idea to have your pharmacist review your medications. And then if you have any side effects, things like dizziness or drowsiness, to make sure you talk to your physician to see if there's an alternative medication that will reduce your risk of dizziness and make you more able to face those environmental barriers that you might be dealing with at your home, so you won't fall. We also find that as people age, sometimes medications that were put on our medication list when we were very young, that might not need to be on there any longer, might be able to be taken off. And sometimes those medications don't come off unless we ask our doctor, is it possible to remove this medication now? So we encourage that you you write down your medications, including any over-the-counter or herbal remedies. Take those to your physician and get a really good medication review at your annual physical every year. The next thing was just making sure that you ask for a vision screening and report any dizziness and discuss solutions with your physician, your optometrist, or your ophthalmologist if you see one. Make sure you do that annually. If you're walking, if you are walking around, evaluating your feet often, making sure that that your shoes fit correctly, that they're sturdy, and that you visit a foot doctor if needed, if you have any peripheral neuropathy, that your toenails are in good shape. Making sure that your feet, especially if you can't feel them as well as you used to, is a really, really important thing to do. And then I wanted to talk a little bit about home modifications, because that's something that we're really excited about in our lab. If you could do a home safety checklist, we have some in our lab if anybody's interested in looking at them, or contact an occupational therapist to look at your home. That's something that you can do to see if, as you've changed, as your abilities have changed over time, if there are things that are new technologies or strategies or things that we can do to make your home safer is a great idea. So we know that, so we talked about that 1 in 4 older adults fall every year. I think it's interesting to note that over 50% of those occur in the home, and only 9 out of 10 older adults don't have any modifications made to their homes. So probably people aging with physical disabilities have some great changes in their home, but we might be able to enhance them with more. I thought it'd be fun right now to take a look at some of the things we see in the home. So there's usually an average of about 4 barriers. When I ask people, do you have any barriers in your home? They'll say, no, we don't have any barriers. And I can walk in and usually find 4 or 5 more barriers. And these are things like stairs without railings or controls that are difficult to manipulate. And we know older adults tend to underreport them. So let me show you some photos of what they have shown me. This first one is an older adult that said, hey, I've got an accessible apartment. I don't really need to worry about home barriers. And when we walked in, if you see that little yellow arrow on the far right photo, that's an upside down 5-gallon tub from the home goods store that the person was using as a tub bench. So sometimes accessible units or accessible apartments aren't customized in a way that's going to be supportive for all of us. So making sure that you have somebody to get you the right piece of equipment to make you as safe as possible. Next slide is an image of someone that told me that my son installed everything for me. It's great. And I wondered why that son was making it really hard for his mother to lift her leg over the tub. You know, if you notice that extra grab bar that doesn't really need to be there, that makes it kind of like a hurdle trying to get into the bathtub, made it a little more difficult for her. So even if you have modifications, sometimes it's worth a peek to see if there's anything that we can do to tweak those modifications to make it best for you. This is my favorite one. The therapist keeps sending things home from the clinic because the therapist has actually never taken a look at my apartment. So things keep piling up in the apartment. In this case, it's tub benches and shower chairs that keep getting sent home. So making sure that you have somebody in to see if the changes actually are what people need and that they fit in that person's apartment. So just a recap here, making sure your home is safe for you, entrances without steps, handles instead of knobs, bathrooms with raised toilet seats, a bath seat in the tub, grab bars, kitchens with lazy Susans, things that you can reach. These are just some examples of things that occupational therapists can help you customize to your home to overcome any physical disabilities you might have to make it more safe and less likely to fall. So I wanted to take a moment because it looks like a lot of folks are going to fall out there. And so I wanted to talk a little bit about being ready for a fall if it's going to happen. And these are some things that some of our participants have come in and talked to us about that I thought were really important take-home messages to help you. And number one is, if possible, subscribes to some of those systems of emergency response. One's called Lifeline. They're kind of costly. So if that's not possible, making sure you have a cell phone that you carry with you at all times. So if you do have a fall, you're able to contact someone for help. I always encourage people to have furniture or telephones accessible throughout their home that they can get to, like maybe pull a cord to a phone over if you've had a fall somewhere in your room. Furniture that's around that's sturdy that you can use to help you get back up if you've had a fall. Towels in the bathtub in case you fall in the bathtub so you can warm yourself up so you're not left cold and shivering if you're in the bathtub as you're waiting for someone to come. And then some folks have talked about some really cool emergency alert systems where they talk to their fire department, tell them that they have a disability, and the fire department helps them install a box like this one where they can keep a key to their home. So if they call the fire department and they need a 911 response, the fire department will use that red box to get in and get a key instead of breaking down someone's door. I always encourage people to have people break down your door if you've had a fall, because it's not worth laying on your floor for a couple days till someone can come and get you. But I know that's been a worry for some people. So getting some type of emergency box installed has been a real relief, I think, for some of the folks I've talked to. So I wanted to share some of those tips that people have used. I understand that the Apple Watch is working for some folks to, if you've had a hard fall, that it can alert folks if you need some help. So those are just some of the strategies to be prepared. But the other thing I wanted to share with you is if you have a fall. So if you fall, it's important to not panic. And if possible, if you're able to, go to ease yourself up onto your elbows, move onto your hands and knees, find a sturdy chair, and get yourself back up if you're able. If you're not able to, then trying to attract attention some way. So in this case, this is an older woman who's using a cane to pound on a wall. Sometimes it's a great idea if you can to pound on a pipe of some kind, because pipes vibrate through a house or apartment building. People might hear you call for help. If you're not able to, it's important to grab a nearby pillow, get yourself as comfortable as possible, and keep yourself warm, because sometimes after you've had a fall, you might have some shock. So keeping yourself warm and secure and not panicking is the most important thing. At that point, it's important to keep moving, to change your body position if you can, to avoid getting some pressure sores, and to keep your joints mobile as possible as you await help. It's important that you always tell your healthcare provider if you've had a fall, to make sure they can then help you go through that list of fall risks, see if there's anything they can do to reduce your fall risks. So I wanted to make sure that people knew that if falls were inevitable, that there are things that they can do to manage a fall once it happens. And I think that's something we need to be better about getting the word out on. So just a few more last words, and then I'm gonna we'll turn the video camera on and we'll take some questions from anyone that has any. But I wanted to reiterate that it's important that we have a better understanding of falls and aging with long-term physical disability. These fall tips we think are going to work for people with disabilities, but they're not evidence-based. They're just the best practice that we know from aging without disabilities. So we're really focused on and hoping to get a better sense of what are the risk factors and who is at risk for falling, what can we do about it, and to actually begin to develop interventions that are developed specifically for people with disabilities. So we're working on that, and we welcome your participation or your interest in that kind of work as we move forward. We will continue to share findings as we have them as we move through our next couple years of our grant. But we're really thrilled for the interest that we have so far, and we're really delighted that these participants have shared their stories with us so we can get the word out that this is an important issue that we need to address. So I'm going to stop my comments right there, and we'll shift over and we'll see if there's any questions. Hi, everyone.
Okay. So I'm not seeing any questions that were typed in, but I have a couple questions that were sent in advance that we can start with.
Great.
And then if anybody has a question, you can kind of, you can either type it or you can unmute yourself and just jump right in. So the first question is, how can service providers identify people who are at risk for falling?
That's a great question. So, I think it depends on who the service provider is. But the number one thing that all service providers need to do, whether it's a physician or a therapist, or even folks at an independent living center or an area agency on aging, would be asking people, are you worried about falling? Somehow screening for some of those fall risks we know about, limited balance and strength, for more medications. So finding out if people are at risk for falls. There are fantastic fall screening resources available at the Center for Disease Control. What we can do is we can put those up on the website, so any service provider can review those materials to just begin to ask and to start the story. Because I found that once we asked in that survey, it was an overwhelming response of this issue. And I know, talking to some of the service providers in our CBR and our community-based research network associated with our grant, that they have also heard these qualitative stories of people who have told them they're worried about falling and falls are happening.
Yeah. They were not as surprised as we thought they were going to be that there were so many falls.
It's true.
Yeah. Another question we had was, what resources are available in the community for those that are at risk?
So this is one of my big concerns. One of my great concerns is there's no specific resources out there for people with disabilities who are aging with disabilities. But a lot of the great fall prevention interventions that we have are available, and I know the service network in Missouri would welcome people with disabilities. So their OASIS is a community organization in St. Louis, and they have a really rich array of programs and services like Tai Chi for better balance, and a whole list of different programs available. Exercise classes that target fall prevention are great. We know that you need to work on balance and strength. Cardiovascular fitness is not what we're targeting for fall prevention. So it's really balance and strength, and things like Tai Chi really focus on balance and strength. There are a lot of YMCAs that have resources. I'm going to give you a whole list, Brittany, so hold on. I got it. So I think talking to your optometrist and just going through a regular service provider for any, even if you don't go in for a fall risk screening, making sure that you have good vision, making sure you reduce your number of medications you're taking. Those are all good things. So any service provider. I think contacting an occupational therapist for a home hazard assessment is a great idea. We can put lists of resources up for folks that are interested in that as well. And I think getting in touch with your long-term supportive service provider, like Paraquad or the Area Agency on Aging, there are an array of programs and services that they have that will address fall prevention. From the Wellness Center at Paraquad, I know that there's a great coalition in St. Louis now looking at reducing fall risk that people can access through their Area Agency on Aging, whether it's St. Louis Area Agency on Aging or Aging Ahead, that were formerly Mid-East Area Agency on Aging. Great resources.
And the area agencies on aging are national as well. So like anywhere you live, you can find one.
Anywhere you live, you can find one. And all area agencies on aging that I've come in contact with have an interest in fall prevention because it is such a big issue for their constituents or the folks that they serve. So that's a great first step.
Okay. The last early question we had was that many clients, especially those with physical disabilities, are intimidated with the idea of starting exercise. How can we encourage them to start and maintain those exercises once they get going, particularly balance exercises?
Right. I think we're all intimidated, and so I always encourage people to take one small step. And then that one small step will lead to another small step. So the first step is sometimes finding out what resources there are in the community, and then making some calls, whether it's a YMCA or if it's an exercise group, making some calls, letting people know that you have a disability, that you will require some kinds of accommodations. If it's too intimidating, I think finding your independent living center, finding the Area Agency on Aging information and referral to help you to bridge that gap, to make that first step. Some folks are finding that the wellness center that we have here at Paraquad is not intimidating at all because there are so many people with disabilities exercising there together. That's a great way to get a first step, is to come visit. I know we don't have those around the nation, but there are different groups around the country that I think are interested in promoting fitness and wellness for people with disabilities. And we'll have Carrie Morgan put some resources up for folks if they're interested in how to access those.
Okay. Let me see. It looks like maybe somebody's typed something.
Oops, sorry. Here
In the mouse. All right. So
No, we have lots of questions coming in.
We do. Okay, so we have a question about sharing our graphic about what to do if you fall. We can put that on our website, and then let me go ahead and type in the website that I'm talking about.
Yes, absolutely. We will put the graphic information about what to do with a fall. We hope to update that so it's not an older adult, so we can find a version of people with disabilities as well. But I think that would be a great resource for folks. We're happy to do that.
And then Kelsey says, the University of Missouri Extension offers 3 fall prevention programs throughout the state of Missouri. So reaching out to your local extension office may also be a great way to find a community fall prevention program. So providing extra resources for us.
Thank you, Kelsey. I think, again, extension programs are another fantastic national model. So reaching out to these are land-grant universities that have a university extension program. I think reaching out to them is another fantastic resource, particularly folks in rural areas that might not have access to the St. Louis network that we have. That's great.
Yeah, thank you, Kelsey. Are there any other questions that we could answer?
Well, we'll check one more time, but just some concluding remarks for the group. Thanks for joining us. Thanks for your interest in this topic. It's something near and dear to my heart. We really look forward to the work that's going to come from this grant to help us better understand what we can do to prevent falls for people aging with long-term disabilities. To me, this is an issue of people who initially left maybe rehabilitation when they were initially injured or experienced their disability, but have kind of begun to have changes over time that we haven't really done a good job in the healthcare system of addressing. So we really want to find some gaps using independent living centers and area agencies on aging and extension programs to begin to meet the needs of people who might have new changes that they could hopefully easily address to keep them safe and independent and participating fully in society. I would love to give a repeat of this survey in a few years and not have anyone tell me they gave up riding the bus because they were worried about falling. I would like to see people still engaged as vital members of our society. So that is my hope. Thanks for listening as we shared a few things. We will put some resources up in the next couple days, look back, and we'll have some things for you. And thanks for coming.
Thank you very much.